Thank you for tuning in to this week's episode of Aging Gracefully, where we will be discussing skin rejuvenation, chiropractics, and sharing interesting advice to keep you feeling younger than you might actually be. All right here on Aging Gracefully on Suncoast FYI. Dr. Sessa returns this week to talk about the benefits of skin rejuvenation treatments. Thank you for coming back. We really enjoyed having you last week. So today we're going to talk about skin rejuvenation and what we can do more naturally to heal our skin.
Yeah. So, you know, we've all heard about omega-3s, how they're healthy for us. Well, they're really healthy for your skin. Omega-3s is one of the things that I really tell people. Of course, good quality water, lots of it. Sunscreen, of course, and we'll get to that in a little while. But two supplements that I really like that are very, very healthy for your skin. One is vitamin C, one is zinc. Especially if you get a cut or a bruise, vitamin C, zinc are very, very good in terms of collagen production. Your body needs those minerals to heal, to create more collagen.
Is there a certain amount of those that we should take every day?
Well, I don't know the recommended daily dose of it, but zinc for sure you want to take between 15 to 30 milligrams per day. Okay. And vitamin C anywhere from 250 to 500 milligrams per day. Okay.
And how about water? You mentioned water, quality water. What do you consider quality water?
Well, it's a good question. That's probably another discussion for another day.
Okay.
But, you know, quality water either you know, you have to be careful what you drink that comes out of the faucet.
Yes, I agree, because I don't like drinking water out of the faucet. So that was kind of a personal question there. But what kind of procedures are available for skin rejuvenation?
Yeah, so skin rejuvenation, that sort of puts the ribbon on the total package. So a lot of times when I do surgery, I will actually perform maybe a facelift, mini lift, or something called a smart lift, which is what I perform, which is a modified facelift, and then I laser the skin afterwards. All done at the same procedure, all one recovery, but the beautiful thing about it is when you remove the sunspots and you wipe off the upper layers of the skin, your skin grows back as smooth as a baby's, and it's as clear as a baby's. So think of your skin, if these are the layers of the skin here, right? Yep. Think of the laser or a nice chemical peel would take off the upper layer, right? So either chemically or with a laser, which is a controlled sunburn. So that when you remove that layer, it forces the other layer to grow more collagen. And that new collagen is new skin. And it comes back tighter, rejuvenated, clearer, better tone. So if you look at pictures, before and afters, that's where the wow factor is. When people say, wow, my God, look at that picture. Because it's not just, yeah, her neck looks great, the jowls, all the muscles, the face is balanced in proportion, but the skin looks smooth, it looks clear. A lot of times you'll hear, why does your face look shiny? It's not that it looks shiny, but a smooth, polished surface always reflects more light than something that is mottled or different colors, so from sun damage. So, so that sort of covers a lot of different things.
Okay, so you use that in conjunction with the facelift, or they can be done independently?
Yeah, absolutely. So you could always do these procedures independently. Irrespective of what they're getting, but it works well when I combine it with other surgical procedures. Okay. Only because with a typical laser peel, this is more in tune of what's called medium depth. So medium depth is the upper layer of that skin, so even part of the another layer. Okay. And in doing that, you require about 4 to 5 days of where you have a very light scab on your face. But think of skin rejuvenation as a continuum. The lighter the peel, the less aggressive, the less downtime, but the less result you get. Okay? The deeper the peel, the deeper the stress to the skin, The better the result, the better the long-term result, but of course comes with a little bit of downtime, usually about 5 days.
Okay. Well, I would think if you're going to make that kind of investment in yourself,
Right.
that you have to take all of those things into consideration that go along with it.
Right.
Now, why is a laser peel better for long-term than other procedures
Sure.
that you may do?
So the thing I like about the laser is the heat is like an inverse plume, right? So if you think of like a hydrogen bomb, I'm very, I think of things in images.
Right.
If you think of like the way a hydrogen bomb sort of plumes up in the mushroom cloud, same kind of thing happens with your skin when the energy hits your skin. The plume is inverted though. So the heat goes down and then it spreads out. So in that heat, it causes the skin to contract. It also causes stimulation of collagen. So in that sense, the laser is always superior than a chemical peel because the peel has no heat generation. You will see the removal of the upper layers of the skin, so you will see the clearness to the skin.
Okay. Does it get rid of the dark spots?
Yes, it will take care of the dark spots, the sunspots, but it does very little for wrinkles.
Okay.
Only the laser will really help the wrinkles, especially around the eyes.
All right.
Yeah.
Okay. Well, for anything else that our viewers would like to know on this or other procedures that you perform, they can go to your website, which we're going to have posted on the screen, and we'll see you next week.
Okay, great.
All right.
Thanks.
Thanks, Doctor. Joining us in the studio today is Dr. Michael Hornberger from Hornberger Wellness and Chiropractic. He is here today to discuss the different benefits people of any age can gain from chiropractics. Thank you for being on the show today.
Hey, no problem.
We have so much we want to talk to you about. Let's start with, obviously, the obvious question, chiropractic. What is it? What is that all about?
Well, most people know a chiropractor to be all about neck pain, back pain, and headaches. And although it's very effective at treating those conditions, its roots are really based in health and wellness. Gray's Anatomy states that the nervous system is the master control system of the entire body. So my main focus is relieving stress on the nerves, so it promotes health and wellness.
Okay.
The spine is made up of 24 bones stacked on top of each other like this.
Yeah.
And at every level you have a pair of nerves that come out each side. The brain communicates through these nerves to every organ, tissue, and cell in the body. So all the vertebrae must move in sync just like this,
Right.
in order for everything to work correctly. Now sometimes
Yeah.
a spinal bone can misalign, or the joints aren't tracking correctly, and that creates an inflammatory process. And what happens is that inflammation can actually put pressure on a nerve.
Okay.
And when the pressure's on the nerve, the communication through that nerve is maybe 80% or
Right.
90%.
Right.
And in turn, that could affect your health overall.
And that's
greatly.
where the pain comes in. And these are the discs?
These are the discs. These are like a ligament in between
Okay.
all of the vertebrae.
What keeps you
that
flexible, right?
Keeps it flexible, exactly.
Okay.
And so what I do as a chiropractor is I find these areas of what I call subluxation. It's the term when the nerve is pinched. And I realign them gently and take the pressure off the nerve.
Okay. Now, obviously, if somebody's having back pain, they would come and see you for that. But who else should go see a chiropractor?
Well, I see people of all ages in my practice. I like to say I see people from womb to tomb, so all ages. And basically, if you have a spine, you should get it checked by a chiropractor.
So basic maintenance to keep everybody safe and healthy.
Exactly. And people get their teeth cleaned on a regular basis. Why shouldn't you get your spine checked?
And how
you see?
often would you recommend that?
Well, it just depends on what's going on with you. If you have an inflammatory situation, typically we'll see someone more often. Once we get the spine optimized, then we see people on more of a wellness or a maintenance basis to keep their spine healthy.
So you treat them after as well to keep them healthy
absolutely,
and happy.
yes.
Now, what having a bad back, this is kind of a, personal question, but how do you avoid having back pain or neck pain or headaches? I mean, and arthritis pains. I mean, is there any way that you can prevent that from happening?
And chiropractic is extremely effective in treating those conditions. However, the real secret is prevention, just like we were talking about. You come in, you get your spine checked on a regular basis. Even if you're not having symptoms, symptoms are the last stage to any disease process.
Sure.
So really what I focus on is wellness and prevention, and that's where a lot of my training is based in. So getting your spine checked, preventing the problem before it occurs is really the secret.
So doctor, can you tell us what's the first thing that you do when a patient comes to see you?
Yes, absolutely. So the first thing we do is we sit down with the patient and we have a talk. We have a conversation, and typically the first visit can take somewhere from 30 minutes to an hour. And we're going to talk all about their condition, and we're going to do orthopedic tests next, or neurological, or whatever the testing needs to be done. And that's when I evaluate and see what the problem actually is.
Okay, so you do that same day, or you
Yes,
bring them? Okay.
Yep, so we'll do it that
That's
same
great.
day. And then if necessary, we do x-rays in the office. We have a digital x-ray system, so we could pull them up in a second, and we
Okay.
could see what's going on with the spine. And I ask most of my patients to give me a day to come back so I could read them and evaluate, put everything together for them. And then when they come back, I go through their results.
Okay.
And we
So-
discuss how we're going to.
So once somebody comes to see you, you determine a course of treatment. How long does that course of treatment take? What does that depend on?
Well, that really depends on what the patient's goal is. In my office, I offer 3 different phases of care. And the first phase is the relief phase, where my main goal is to get you out of pain as quick as
Sure.
possible. And that could take 1 treatment, that could take 10 treatments. It really just depends on the individual and what's going on with them.
Okay. Well, and again, you keep following up. You don't let them leave you until you feel that they're ready to go and
Exactly.
feeling better and out of pain.
And exactly, and that leads me into the second phase of care. Once they're out of pain, many people choose to keep coming because they want to optimize their spine and the biomechanics.
Right.
And this is when people get their range of motion, they're more mobile, they can do things
And
that they
they're
haven't
feeling
done
better.
in 10 years.
Great.
So-
Well, we're going to talk about that when you come back and join us next time.
Sure, absolutely.
So for now, though, please share with our viewers your website so that they can go and find out more about you.
Sure, it's hornbergerwellness.com, and you can check out all the information you need to on the website there. Yep.
Well, thanks for being with us, Doctor.
No problem.
Appreciate
Thanks
it.
for having me.
Please stay tuned for more advice on how to age gracefully. Our next 2 guests come to us from the Fred Astaire Dance Studio here in Sarasota, Tim Penanga and Tiana Ramirez. Thank you for being with us.
Thanks for
This is
having
so
us.
exciting. I love
you.
dancing. I want to hear more about it. So tell us about your studio.
Well, the studio has been there for a little over 40 years now, right on the corner of Tuttle and Swift. It's actually the second oldest Fred Astaire in the country, at about 160 dance studios. It's a fact we're very proud of.
Yes.
And for the past, I think,
Yes.
27 of those years, we've been voted the best place to ballroom dance in Sarasota by the Sarasota Herald Tribune. So it's a
Well, I mean, Fred Astaire's name is just synonymous with dancing. So
It is.
let's start first with what is a typical day like at your studio when you go in there?
So our days start at 12. So those are our mornings. So morning
I
for
like
us
it.
is 12.
I like it.
We typically start just getting all the staff prepared for the day, and then our private lessons start whenever. So from 12 to 9 are the studio hours, and we kind of just book everything around your convenience, anyone's convenience, because we don't want it to be like you have to be here at a certain time every day.
Right.
So we have our private lessons. Every evening we do have group lessons, and then on Friday nights we have our studio socials. So we have a big party.
So everybody comes. Everybody can come on Friday nights. And what time is that from until?
That starts around 8 o'clock and it goes until about 9:15.
9:30 sometimes
9:30.
if we're having a good time.
Yeah.
So a
we
little
don't
social
cut it.
time, a little social time. So again, we know that Fred Astaire was the most amazing dancer ever. What type of role does he play in the studio setting today?
Well, as the story goes, in 1947, Fred Astaire was coming out of an event, and he got into his limo, and the limo driver asked him, can anyone learn to dance? And his response was, any dancer he knew that was good was taught or learned how to dance through some way. So that gave him the idea to start the studio back in 1947.
Okay.
And a few years later, he was still busy with movies and shows and things, so he allowed his name to still be used because of the belief in the product of dancing.
Okay. All right.
So his name, we're still proud of his name, we use it,
Sure.
and we still use the same system of teaching that he started back in 1947.
Okay.
Which is
Now-
really,
Yeah.
it's cool to still have that because, you know, a lot of people notice obviously his dance talent and, you know, what he did with the movies and dancing, but to be able to say that we are still using his curriculum, you know, not necessarily his exact curriculum, but his
Right.
way of putting it together
His
and his
ideas.
systems and teaching it.
Yeah.
It's kind of, I don't know, it's special.
Well, it is, and that's it. I mean, everybody recognizes the name, and I think that is just, you know, where you should learn how to dance is at a Fred Astaire dance studio.
Absolutely.
Right?
We agree.
So, what type of experience, if any, do you recommend that somebody coming in has?
Well, I think Tim said it best as far as Fred Astaire is saying. You know, good dancers are not born; they're taught and trained. Just a little background: Tim and I have no previous dance experience. We were taught the system, the curriculum, brought up the same way as most of our students do when they come in. So you don't have to have any dance
Any
experience.
experience, and the age range. I mean, anybody can learn to dance.
Absolutely.
Right?
anyone.
Yeah,
It's
we have
timeless.
our clientele are anywhere from 93 all the way to 6 years old, so,
Okay.
and everything in between.
Okay. Now, how would somebody, our viewers, go about enjoying your studio?
Pick up the phone and call us.
Or pop on in.
Yeah,
Or pop on
just
in.
stop in, you know, because we are located in a very well-known area in Sarasota. Just to call the studio and schedule, like I said, anything that works best on their schedules. But it's just very simple. They come in and we introduce them to the studio, to, you know, Tim and I and their instructor, and we kind of go from there. So very
Very friendly atmosphere.
laid
environment.
back.
So it's anybody that wants to just get some exercise, come in, learn what dancing's about. And again, they can stop in and chat with you, because I think that would be a nice way to kind of see what it's like, kind of get a feel and break themselves in. I know that you do a lot of events and social activities. So what type of things can our viewers find with you doing that sort of thing?
Well, we have private lessons are what we mainly do, but at least once a day we have group lessons, which is a
Okay.
group setting. We have anywhere from 15 to 20 people in our groups, and every Friday we have a practice party.
Right. So the group lessons, what time of day does that take place?
Those are usually around 6:15 or 7. So they're
Okay.
typically in the evening, so they can accommodate a little bit of everybody.
Okay. And can anybody kind of walk in to see that if they want to see what a group lesson is like? Would that be a good way to
Yes,
start?
Yes.
Yes.
Okay. All right. Now, I know that we're going to have you back on, and we're going to talk about some other things in the upcoming series. So what will those be like? Can you give us a little tease of what we can expect?
One of my favorite things about being in this business, not just because it's like living a movie, but is watching what people gain through dance personally. Whether it is meeting new people, losing weight, gaining more self-confidence, overcoming, you know, shyness. There's just
Right.
so many benefits that are associated to learning how to dance, and the physical aspect behind it. It's just always been my favorite part, is to
great.
actually look at someone and say, wow, I get to see this and I'm a part of it.
Right, right, and that's it. Again, like you said, anybody can come in, anybody
Absolutely
can learn
anybody.
how to dance in any age.
Yes.
Great. Well, thank you so much
Thank you.
for being
Thanks
here,
for having
and
us.
we'll see you again soon.
Excellent. Thank you.
Awesome. Thanks for joining us this week on Aging Gracefully. Tune in next week where we'll be discussing eyelid rejuvenation with Dr. Sessa.